is how on genetic level, how genes in the skin responded. So this is like how serotonin, gene, which is a youth marker or anti-aging marker.
Gene.
Yes, gene responded comparative to control.
And the Ambra-Lift increased the
Yes.
expression of it.
Expression
and the collagen is considered a biochemical marker of wrinkles. Decreased expression is associated with wrinkles. Ambra-Lift increased the expression. And then
Yes.
collagen 4A1 and A2 are important for maintaining skin firmness and increase the expression too. You can see here where the red is for the anti-aging, anti-wrinkle genes. So it made
So
an
you
effect.
can call it not only cosmetics, you can call it anti-aging product. Plus, this is another tub which demonstrate antioxidant genes and anti-inflammatory work. It's decrease the inflammation. So it's increase in anti-inflammatory property. Yes, and it's also produced that antioxidation. So you know, antioxidants playing the very big
We don't
role
want to
in
rust
aging.
our pipes or our skin,
Exactly,
right?
exactly. So this practically scientific.
And you know, this
proof.
inflammation, this can happen, and I found this to be true because Dr. Christine Sargent in Wheaton tested me for food sensitivities. And I had food sensitivities to 20 different things, and that can increase inflammation in your skin too, where you don't even realize where it's coming from. So this can decrease it.
Yes, and this is a histological tissue analysis. It's how tissue under the microscope looked. This is a control group, so it's
The
untreated
epidermis
group.
here is healthy and organized into well-defined cellular layers. The dermis contains numerous viable fibroblasts. With Elina's, the tissue appears healthy. Basal cells in the epidermis appear more densely packed. Cells in the stratum spinosum and stratum granosum contain well-defined cells with apparent keratohyalin granules. The dermis contains numerous viable fibroblasts. So there's an improvement there.
Yes, obviously, you can see the difference. So practically, if some people tell me, I don't believe in natural, organic, it's not a drug, it's not, and usually, you know, when you go into a health food store, lots of people will say, oh, nobody proved those herbs are working, because it's not proven, it's not proven. That's what always people who work with organic products or natural approach or holistic approach hearing, because literally not so many studies been done on natural herbal formulas, because usually those companies are smaller company, they very often can't afford expensive studies. So this is the studies now. So nobody can tell me, it's just my fantasy, okay?
Well, all they have to do is look at your face.
Oh, thank you. And your face. And Nadia's face.
That's right.
Yes. And now if we can see Nadia trying to show.
Okay, let's look at what Nadia is doing. She's got all these red and blue lights going. I get to see it now. I've had this done, and I don't get to see it when I'm having it done because you keep your eyes closed. Nadia, tell us what you're doing right now.
I actually just applied the anti-wrinkle mask with Ambra-Lift and anti-wrinkle moisturizer and the DMAA. And then I use the LED, which is a light therapy, blue light and red light, and it has a lot of anti-aging properties. And right now, what I'm doing, I'm working with a dermal laser, which creates a muscle stimulation. And the light, actually, that dermal laser head goes underneath of the dermis.
So it soaks in
12
better.
centimeters. So it's a very
It's very
extremely-
rejuvenating
Yes.
and increase collagen buildup.
with the reproduction of
Practically.
collagen.
Yes, practically, it's a machine is combination of microcurrent kind of to stimulate the muscles with called soft laser
And
or
it-
LED. In other
And it
words.
does stimulate especially the muscles that you would never be able to work yourself out.
Can't exercise them yourself like that, no.
Yes, because you can't run and jump on them.
Which one?
But what also I want to talk to bring to the conversation. Lots of women think like, yes, I'm getting all the plastic surgery, nothing else, or Botox or some kind of fillers, because they think facial treatments it's more pampering than effective. And maybe many facial treatments are pampering, but I would like to prove you today, like facial could be pretty pampering, and normally Pam would be laying down on the bed, but we set her up just so it would be more visible what Nadia does.
Oh yeah, it's like my favorite time of the week.
Yes, when you're laying down and relaxing, it could be very pampering.
Right.
But in the same time, you really can see visible improvement because I don't think woman should come just to be pampered to the skincare place. She's supposed to come to be more beautiful, to preserve your beauty, and actually to produce anti-aging result, lifting result. And that's what we're going to demonstrate today. And normally, every procedure in my place will include deep cleansing, which will start with steaming, detoxing, cleansing, of course, detoxing, pack, exfoliation, vacuuming, deep extraction.
And these are not all extras. These are things that are involved in the facial.
It's a part
so
of the
it's like,
facial. It's
you know,
not
sometimes you go into a place, I went into places years ago, and they say, well, okay, well, what do you want? Okay, well, do you want this extra treatment, or do you want this, or do you want that? That's not what you do.
No, we don't do any extra treatments because I don't believe in, like if you're coming for dinner, you know, I believe like you can have everything you need and you want. And we're charging you for one-time dinner. This is a treatment, like herbal facial. And whatever your skin will need would be included in that procedure.
Well, that's the other good thing. You don't ask the person because we don't know what we need.
Yes, exactly.
I mean, we don't know what we need. That'd be like coming to the hospital and saying, you know, what do you want now that you're here? You know,
that's
like,
so funny because lots of time you're coming into the salon and you're choosing like, oh, I want an oxygen treatment or this treatment or that. You don't know exactly.
Right.
And that's why practically very often we set up consultation with the client. So client can come and first of all to talk to Nadia or another practitioner and decide what could be done for them and create some kind of program. Also, the clients can receive samples of the products or if they decided to choose to purchase the products right away and they like them, they get in them. And we may right away adjust the product to tailor it to their particular need. But they can use the products for like a week or 10 days and come back and say, oh, you know, maybe it's a little bit too moisture for me or not moisture enough or whatever. And we always will adjust to that particular situation.
Well, you know, what about people with acne? Now, I've never experienced acne, but yesterday I had something here because I actually cut myself with glasses.
Yes.
And it got a little infected really fast. And I mean, I was going to see Nadia and she took care of everything and now you can't even see it. But people who suffer with skin problems and things like that, I mean, this would really be a great help to them too.
Oh,
right?
yes, we have special program for acne. And it's, what is the acne? It's a hormonal disbalance which produced extra oil production or sometimes, and it's a breaking out, skin is broken out related to hormonal or extra sebum. So what we can do for that, practically, if you go to the dermatologist, usually acne treated with antibiotics, which kill bacteria, but not necessarily only antibiotics can kill bacteria if you're using proper topical products, which naturally, herbally, you know,
well, and the other
can
thing
kill
is
bacteria.
antibiotics do have
that.
side effects too.
Exactly.
And they can kill the normal flora in your stomach, and then you have to take something to create the normal flora back, or else you have stomach problems.
Absolutely,
so
probiotics and
stay away
enzymes.
from them unless you have infections.
Yes, and I think we need to leave antibiotics to save our life in the situation of emergency. If somebody like we have like car accident, we need antibiotics to prevent severe infection, but we don't need antibiotics for acne because it's a chronic condition. It's a tendency to have acne last at least 7 years. So we can control that condition with natural substances.
Well, I think the thing that I've liked the most, I mean, I liked it all, but as far as my eyes are concerned, with the wrinkle and slowly but surely tightening all of that under here, which I did not want to have surgery for. And actually, some people have great surgery for that, and other people have surgery and their eyes won't even close anymore. You know, so, I mean, you're taking a big chance sometimes when you take any kind of surgery. And some of them turn out wonderful, but it's not something I wanted to do. So this has been a steady, slow change in it, though, which I really appreciate.
But also surgeries, it's alteration. They don't use biological anti-aging effect. It's just stretching, lifting, mechanical removing. But what we're talking about, anti-aging products, which create, like increasing the collagen naturally, instead of injecting cow collagen or in other fillers, it's increase your own collagen.